have questions. If you guys have questions for me, you can raise your hand. You can use the chat box feature and type them in there anonymously, and I can address them anonymously. That way, whatever works for you, we'll work with it. We'll kind of just start by discussing what reclaiming intimacy is, what we are. And we are an advocacy organization, and we focus solely on intimacy issues, sexual health, sexual wellness, and of course, sexual dysfunction. We work the most with cancer patients and their partners, those who are facing long-term illness, and then, of course, those who experience different types of sexual dysfunction due to age, due to hormone changes, menopause, and more common things in life as well. And we do that by partnering with organizations just like the Red Door community and support organizations that are there for patients to bring those resources and that information to help empower all of you so that you know all the things that our bodies can do and all the choices you have when it comes to kind of reclaiming your intimacy needs in your life. And that's different for everyone, which is why much of what we do is so customizable. And lots of these things, I'm not going to say all the words on these or go through all of these in detail because this slide presentation will also be shared at the end and sent back to Erin so that you all can have a copy if you need to go through it or to revisit it at a later time. But our staff is always here for patients and medical professionals. We kind of act as a middleman for patients who are looking to find help or find doctors and oncologists and physical therapists who are sex positive, who understand the different sexual dysfunction issues more so than just offering more medications or surgical options. There's lots of options that are holistic that you can do with your own body in the privacy of your own home that so many people just aren't aware of. And that's kind of what we cover. And we work with people and patients as long as they need us. From the time that you say, hey, I'm having this issue, what can I do? Until the time you say, hey, I've got it, I'm good, I'm where I want to be. We're there with you. The services that we offer for people are all free. The only things that are on our website that cost anything are the devices themselves. And most of those actually have possible insurance coverage if you're using them with a cancer diagnosis. So that's something that we work with people and help them with. One of the things that we do offer for people is the Personal Intimacy and Wellness Guide. And this is a guide that is designed specifically for your situation, the issues that you have going on. And it includes information on the different devices that could work for you, lots of video, educational video links that we have done with our partnered professionals, which I'll talk about here in just a moment. And then the guide is sent back to you and you can kind of keep it in your side bed stand if you need it, or if you don't need it, until you do. And it's just for you. And then like I just said, we have a lot of new educational videos on our website. And the videos are actually interviews and chats with our professional partners. So we've got oncologists, we have gynecologists, we have nurse navigators, nurses, all sorts of different people in the realm of all things medical. And they discuss things like breast cancer, pelvic floor health, colon cancer, and how all of these things can hinder intimacy, our bodies, and then, of course, sexual function. And all that kind of stuff is on our website, should you need that information. And we've got courses that cover lots of different things. If you need them, you just check in with us and we send you the information and we help you work through it. And then these just cover some of the topics that we do cover. And again, I'm not going to go through every single thing. Lots of pelvic floor therapies for men and for women, breast and chest cancer information, lots on vaginal atrophy and erectile dysfunction, all those very common things that many people are world. And then, of course, the different devices or the therapeutic aids. And these we'll kind of talk about in a little bit, the most common types that you can kind of look for when you're out there searching for different things. And these type of products are designed to help you kind of restore function, help your body to work with the nerves that have been damaged if you've had a mastectomy or surgical interventions for your cancer, and kind of help to reawaken the body again in a more natural way. And like I mentioned, some of these products can be covered by insurance. That's a lot of people aren't aware of that. And that is something that we help people do. If you should have questions about that, please don't hesitate to ask. This is just a list of some of the different things, different types of devices that are out there specifically designed to help restore lost function when it comes to sexual dysfunction. And then recently, we've kind of gone through a lot of changes on our website with all of our services now being free. We've also added a ton more devices that kind of encompass many more people, is much more inclusive to many more disabilities, many more body issues, and many more types of sexual dysfunction. And so those are all there too. And another thing we do for people, if you have questions, if you have any of these devices that you already have in your house and you're not quite sure if you're using it correctly or you need some tips or suggestions, we do have monthly open house sessions, one Saturday a month, where you can come and ask these questions, get advice, get some tips and guidance if you need them. And then, of course, our contact information is there as well, which Erin has as well, if you should need it. And that's all the pre-informational stuff. So now we get into the meaty part of the presentation, which is discussing intimacy and body image. Let me check the chat box here real quick. I will add there's a question in the chat box that asks for our website. I will add that here in just a little bit once we get through and make sure everybody has them. For part one is we start with defining intimacy. And it might seem kind of redundant because, intimacy is intimacy, right? It's different for all of us. So when we do our presentations, whether we're in person or we're doing virtual, we always pose that question of what do you first think of when you hear the word intimacy? And you'll notice that there's going to be a few questions like this one in bold through this presentation. And if you don't want to answer them now, that's fine. I always suggest that you write them down maybe for journaling later, and you can revisit them with yourself or your partner and kind of have a discussion together. But for so many people, when we ask the question, the first thing they say is sex, because somehow in our world, intimacy has equated to sex. And the truth is that intimacy is so much more than just physical sex. There are so many different types of intimacy. Some we will talk about here in just a moment. But the definition is the state of being intimate, very warm and friendly, or something of a personal or private nature. Our innermost thoughts, our inner goals, the things that we don't just share with anyone. Of course, you can see some synonyms there too with rapport, attachment, closeness, familiarity. But truthfully, intimacy is that deepest parts of our minds and our souls that we have to be so comfortable and supported and safe to share with another person. And again, that's not just sexually, that's not just physically. And then, of course, the question, what does intimacy mean to you? Because again, it's different to everyone. The importance of intimacy in a relationship. Intimacy is derived from the Latin word intimus, which means inner or innermost. And it allows us to bond with each other, to connect with another person in different ways, more than just a friendship. Intimacy exists in every relationship that you have with your children, with your parents, with your neighbors, with your coworkers. And each relationship is different. Each relationship requires different types of intimacy, different types of support, and different types of connection. And here are some of those types of intimacy needed. These are what they say the top 5 types of intimacy are, and that's physical intimacy, which is, of course, sex acts, sexual intercourse, skin to skin touching. Emotional intimacy, which is kind of built into relationships, and both parties have to kind of engage in emotionally supporting one another, whether that be within a marriage or partnership, in a friendship, or even in familial relationships. If one person is not so present and is not so connected, that emotional intimacy can lack, and that can kind of make a roadblock in a relationship. Intellectual intimacy, which is, exercising your smarts, your mental side, broadens relationships with people. It gives you new perspectives. All sorts of different things go into intellectual intimacy. Experiential intimacy, how your shared experiences with another occur and grow and evolve over time. And then, of course, spiritual intimacy. Many people are very familiar with that. It's not just limited to religious ideas or church ideas and beliefs, also similar values, morals, and core beliefs. And with those types of intimacy, those ebb and flow in all of our relationships, especially in our marriages and partnerships. And when these things lack or some of them lag, it can cause problems. So, this is why making sure that intimacy is defined well for yourself and then within your relationships is very important, especially when things like sexual dysfunction creep in. Then it's much easier to work through and deal with when everyone is on the same page. Body image and cancer. Body image is how we feel about ourselves, how we see ourselves in our bodies, and those thoughts that we have about ourselves and our body image directly impacts everything we do every day of our lives, mentally, physically, our daily actions, our confidence, how we interact with others, how we handle stressful situations, even. And this is true for both males and females. And then depending on, where you are in life, your age, where you're moving through, lots of different life circumstances can also cause emotional tolls that then hinder our body image. For women, menopause, breast cancer, mastectomies. For men, losing body parts with testicular cancer, having pieces removed. Everything like that hinders our body image. And major medical chaotic events like cancer really have the hardest impact. Depression, anxiety, isolation, the loss of intimacy, not just physically, but just the connection with people. And that overall just kind of lackluster for life are what we hear the most. Many people also report that they have lost confidence in their bodies. They feel that their bodies have failed them. And they believe that that sense about their body is just not being up to par, not as good as somebody else. Makes them feel vulnerable and can make it even harder when dealing with or trying to improve your body image. And body image is a part of our self-image. It encompasses our physical appearance, our thoughts, our perceptions, our feelings that we have about things, our feelings about our body and how it functions. And anything that changes that for us can really cause a negative body image impact. I like the quote at the bottom of this, that more than half of all cancer patients struggle with body image at some point in their cancer journey. And I don't like it because people struggle with that. I like it because it lets people know that they're not alone, that everybody that's going through something, which is really most of us in this world, if we're being honest, is struggling, and we struggle with our body image at some point. And the important thing to remember is that there's always ways to work on that body image, to change our negative mindset to positive, and really come out better on the other side. These are just some of the ways that body image affects our self-view, loss of self, and relationship disconnect. Some of them I've mentioned already, but a few I haven't. With the loss of self, even the simple changes that occur when we are going through cancer and even into survivorship, the changes to our normal routines. Sometimes we don't think that, simply changing what we have to do each week that we're used to can really hinder our mental state as much as it does. But truthfully, once we are set in routines, that can really throw off the mental state. And it can make it harder for continuing with things like your passions and your hobbies and the things that you do on weekends when you're not feeling great and you're not looking the same and having that loss of your own bodily identity. And of course, with relationships, the disconnect happens, and it can happen for a multitude of reasons. Cancer is very stressful. Treatment is very stressful. Going into survivorship, also stressful. The lack of communication that can occur, the disconnect from your partner, feeling like you can't fully share how you're feeling because maybe it upsets your partner or they don't know how to respond just because the situation is so heavy. All of these things can cause trouble in maintaining that connection with your partner. And that's why we have a lot of different exercises and kind of like things you can do together with your partner and alone to help kind of bridge that connect, to kind of reignite that spark in the relationship. So that's something that we help people with as well. And these are, I guess I should say, when you see a list of like symptoms or side effects or anything that I'm going through here, these are lists that we've compiled as we've worked with people since 2014. So of course, there are many more issues that could be listed on all of these. These are just the ones we hear most frequently that we've added. So for all genders, male and female, the most common physical and body image changes that affect us, the scars, loss of hair, loss of muscle tone, the frailty, of course, the loss of sexual ability and function, different skin issues, which can include rashes or sores, changes in our body shape and size, loss of organs or body parts, fertility issues. Sometimes we end up needing ostomy bags or feeding tubes, hormonal changes, and then, of course, body pain. Some of these are just temporary. Some of these will go away, and others will last a lifetime. So it just kind of depends on your situation. And then, of course, for men, they also see a change in their penis size and girth, and then erectile dysfunction occurs more often than not. And for females, the loss of breast and breast tissue with vaginal pain and atrophy and early menopause are the things that we hear the most and people seek help for the most. And again, like I said, while there are so many other side effects, these are just the main focus that most people come to us begging for help. And then there's another question there for you of what physical issues or changes have most affected your life and your body image. I'm going to take a quick drink and check the chat. Okay, chat is good. Behavioral health and life tips for improving body image. And again, I won't read all of the words on here, but this is something that we find people struggle with. Sometimes we get so wrapped up in our heads worrying about ourselves and worrying about our body image and the changes that have happened. We don't really leave room for the very simple, beneficial things that you can do to kind of boost yourself and give yourself those boosts that you need. And the first one is being aware of your internal self-talk. So the thoughts that you have about yourself in the morning when you're looking at yourself in the mirror while you're brushing your teeth. Make sure you're taking the time in those moments to tell yourself good things, loving things, things that you like about yourself, things that you are good at. When we do that each and every day, that changes our mindset from the things that we can't do to really focusing on the things that we can do and the things we can hope for. Understanding your communication needs. This is a big one because in partnerships and marriage, every person communicates differently. And if stressful situations arise, this can often kind of show all the nicks in the armor, if you will. So by determining how your partner best receives and gives communication, and then for yourself, you can kind of come together in the middle and join back together again. There's one thing I always like to mention, the Gary Chapman 5 Love Languages quiz. It's a free quiz you can look up on the internet, which I can put in the chat here in a minute as well. And you can take this little multi-question quiz. It just takes a few minutes, and then your partner can take it, and it will tell you what your love language is. And then it will tell you, once you know both of yours, how you can best connect together and best communicate together and best love together. And it's pretty accurate and it's kind of interesting to do. So it might be something fun to do on a date night if you haven't done that before. And then another is to try positive new sensory experiences. Getting your mind off of the everyday things that you're used to doing, throwing something different in the mix, whether it be by yourself or with your partner. This can kind of ease the mood. It can open up doors to new things. It can ease your mental state. There are also lots of apps on the market these days that are designed to help with your mental health. The Calm app, 10%, or even Headspace. I really enjoyed Headspace when I was on it. And it kind of gives you something else to do and focus on and teaches you a little bit about yourself while you go. Many of those apps are free. Some of them do have a small fee. Taking care of your body. Many cancer support agencies suggest that their patients be active at least 150 minutes per week. But of course, make sure people are checking with their doctors before they just start any exercise plan, especially when dealing with cancer. And then, of course, healthy eating and regular sleeping, all of those things help us to be mentally and physically whole as well. Seeking support. Of course, that's a big one. Support groups are great. It lets you meet like-minded people. It lets you learn about similar experiences or treatments worked or didn't. And it's also great for your mental health as well. There's just a few more tips here. To change your lifestyle. This could be an opportunity to try a new hairstyle, a new clothing style, use new colors of your clothing. I know I am very partial to black and grays, but occasionally when I get really stressed out, I tend to wear a rainbow. And that can kind of help your outlook, even for the day, just to kind of give you something positive to focus on. Staying active is also very important. It can help your mental health, your physical health, and then, of course, your whole body healing. Staying active can mean many things to many different people. It could be doing simple chair exercises if you are in recovery or unable to get up and move around, going for walks, going for jogs, doing yoga. I mean, really, the options are endless. Facing your intimacy issues. This is one we discuss a lot at Reclaiming Intimacy because so many people ignore these issues. So many people feel that, well, I've got cancer. I'm going to spend all of my time battling and just eating this cancer up because I'm going to live, which is amazing and important. But you can't just put intimacy away because we are humans and we were designed to need intimacy. And again, not just physical, all those types we mentioned before, plus various other types. There's actually the 5 types that we talked about. There's actually over a dozen other types of intimacy too. Chaos intimacy, creative intimacy, the list go on and on. So when we put those to the back burner, so to speak, and we ignore them, those issues just build. The longer we wait to address these issues and the more we just kind of ignore them and let everything go, the harder everything will be to get back on that path, to really be okay with our bodies, to be okay with the sexual acts that we want to be doing. And for some issues, erectile dysfunction, vaginal atrophy, the longer you let them go, the worse they will get. Saying of if you don't use it, you lose it is actually true when it comes to the genitals for both men and women. When they are not used or not worked out, much like working out our other muscles that we work out all the time, they stop working. So that's just kind of something to keep in mind. And that's something we always tell people that if they are struggling with, don't be afraid to bring it up to your doctor. They might not have the answers immediately, but they will be able to link you up with a person or an organization like ours that can help. And then try intimacy without intercourse, because intimacy is not solely intercourse. Try different intimate settings, cuddling on the couch, trying a gentle massage, making dinner together, enjoying outdoor activities together. If you need self-intimacy or self-care, that's taking care of ourselves, but we can then take care of others. Practice some self-care. Take yourself out on a date. That's okay too. And then the last one here, own and hold your boundaries. Understanding that you are in charge of when and how you decide to discuss your life, your cancer, your illness, your intimacy needs, your sexual needs. It's your choice. This applies everywhere. You should never feel pressured to disclose or talk or do things that you do not want to do. Others may be comfortable being open about everything from the start, and you might not be, and that's okay. Those are your boundaries, and they should be respected. So those are tips for that, for kind of reclaiming and working on your body image. If you have any other tips or suggestions for yourself or others, you can share them in the chat or just journal them for yourself. Touched on self-care a moment ago, that is how we take care of ourselves so that we can take care of others. And just some different ways of self-care are listed here with pampering, new adventures, new relationships, journaling. My ways of self-care are books and plants. That's why my background is what it is. Those are my favorites. And that kind of helps me to level back out when I've had a really hard time. So there's another one of those questions for you. How do you practice self-care? And then next, the next 2 slides are lists of physical and hormonal changes for women and for men. And you'll find as I go through these that they're both very similar, which is natural because our genital tissue is basically the same. So for women, the women's side is first, which is incontinence, and that can be for the bladder or the bowel or both. changes to the vaginal lubrication, the natural lubrication, changes to the vaginal tissues. And those changes often occur, if I jump down that slide a little bit, to the vaginal atrophy section. Vaginal atrophy affects nearly 80% of women at some time through their life cycle. This doesn't always stick and last a lifetime. Sometimes it does. But for many, it kind of comes and goes as hormones fluctuate, and certain medications can also cause this. And then, of course, cancer treatment. And vaginal atrophy is the loss of elasticity, the stretchiness and the pliability of the vagina. The dryness, which can range from just a mild dryness to a very painful, very severe dryness, where even wearing underwear causes friction, pain, and sores. So it just depends. And then all of the genital skin with vaginal atrophy thins, which makes it very dangerous for small tears and sores. And that's where using a lubrication really, really becomes important, because the smallest of tears in the genital area can create really big infections and issues, which none of us want. So that's what vaginal atrophy is. And then, of course, due to chemo and radiation and surgery, low circulating estrogen, which can lead to early menopause and hormonal issues, decreased libido, and the loss of fertility. Altered anatomy if surgery has happened, and then mucosal alterations. And it's not just the genitals that dry. When dryness happens in the body, it's every single place that has mucosal tissues. So our mouth, our nose, the vagina, the anal canal, all of the places, even internally with some of our organs. So that's kind of interesting. And if you are a woman and struggling with that, you can consult your oncologist, your patient navigator, your gynecologist, or a person like me, a sexual wellness expert, for direction. For men, the physical and hormonal changes, again, very similar to that of women, the incontinence, bladder, or bowel, or both. And then the changes to their normal sexual function for a man. Normal sexual function for a man, for an erection to occur, they need 4 of their body systems to be working together at the same time. And that's vascular system, the neurologic system, hormonal system, and psychological systems. So if one of those systems aren't quite working 100%, maybe they have some heart condition, or they're having a lot of stress and mental issues. That might mean that they can get an erection for a few seconds and then it disappears. Or for some men, it means they cannot get an erection at all. It just kind of depends on which systems are kind of malfunctioning, so to speak, or what has happened as to how that, how long or how firm that erection might be. Men can also have surges of hormones. And if they have a lack of testosterone, that can lead to libido issues, desire issues, and things like that. Loss of sensation is a very big complaint for men, especially in the genital area. Penile pain. And then declining functions with cancer, conditions, or treatment, erectile dysfunction, which can be occasional, partial, or a complete loss. If there has been a surgical intervention for cancer, most often the erectile dysfunction is considered a complete loss. If a person has a complete loss and they cannot get an erection, there are little things other than surgery that can permanently adjust that. So the holistic measures and devices, the penis pumps and support things, those are going to provide that temporary action and allow that man to temporarily be able to have penetrative sex or to temporarily be able to have an erection. They also face the loss of libido. And then there's also something called abnormal ejaculation or ejaculation dysfunction, which means that a man is either ejaculating too early, it is delayed, or it's completely absent altogether, which is also called dry ejaculation. And for a man who's suffering with any of these issues, you can ask your oncologist, patient navigator, urology specialist, or a person like me. Does anybody have any questions on part 1 before we get into part 2? Okay. So part 2 is grief and intimacy. And this one is a little tougher to work through. This one has some feelings with it. And it's not always happy feelings, but we're going to work through it because this is a very real thing for so many people in our world. that they are working through right at this very moment. So to those who are grieving, this experience changes basically everything in our lives, as we know. Um, Aside from our feelings, the emotional feelings that come with that, and the memories and everything connected to whatever we have lost or whoever we have lost, this also changes things within ourselves, changes how we react to intimacy and how we react, how our responsiveness is to those sexual acts or sexual feelings. If it was a loss of a partner, loss of a family member, especially partner, we might struggle more with feeling those sexually related intimacy feelings. We might feel like we shouldn't be feeling those at all. And for a while, for some people, it's very awkward and they avoid those types of feelings. These types of changes can be temporary. These can last for months, these types of feelings, or even years. It's different for everyone. There are no rules with how long a person has to grieve or can't grieve or should stop grieving. No rules here. And in these times where you're grieving, it is absolutely okay if sexual activities or intimacy activities are just left out. That's okay, because we need the time to work through these grief feelings that we're having to reconnect with ourselves and whoever we're trying to connect with again. Intimacy allows people and couples to enjoy the much needed comfort and connection, removing the sexual pressure. By leaning into the other types of intimacy, emotional, chaos, experiential, even cuddling and massage, this can help support the patient and the relationship facing grief. Because grief, again, is not always just loss of a person. Sometimes it's loss of our abilities, it's loss of our normalness, it's loss of our routines. Grief can come for a variety of ways. So we're going to kind of touch on all of those different ways here. Working through the stages of grief to get back to intimacy. And depending on where you are within the 7 stages of grief, and of course, those stages tend to repeat and go back and forth and ebb and flow. You may need to spend time communicating and connecting with yourself or your partner, with your new needs, your new desires, your new likes. It just kind of depends. And the 7 stages of grief are listed here: shock, denial, anger, bargaining, depression, testing, and acceptance. And through the stages, like I said, everything ebbs and flows. One day could be shock, the next may be anger. Then a few days later, you might be back to shock. It just bounces around. And again, that is okay. There's no rules to grief. Avoiding negative intimate moments. So for the people who are grieving their loss of ability or their body losses, communication with the partner. I always like to say that communication is the lubrication, because without it, everything is kind of rough and dry. And communication helps us to avoid misunderstandings and miscommunications about intimacy, sexual activity, or even our needs that come every day that have nothing to do with sex or intimacy. Redefining intimacy and sexual needs separately means by yourself first, really knowing what you want intimately and sexually, and then together as a couple. So then you come together and you kind of compare notes. This is what I want. This is what you want. Okay, let's put that together and see if we can work it out. Taking it very slowly, taking things step by step, not rushing back into things, especially sexual things. If you've been struggling for a while, you want to take your time and give yourself the space to reconnect at every level. A bad example of this is the old bases. You know, you're at first base, second base, third base, home, comparing them to different sexual acts. We never want to just randomly go play baseball and just run around back to home. If it's been a while and you're struggling through things, it's important to take time to stop at first base, check out all of the things that first base has to offer before you walk to second base, and take your time when you're walking. There's no rush. I know that this world makes it hard to not feel rushed with so much. These are some actions to work through grief with your partner. So if grief has entered into your life, into your marriage or partnership, these things might be helpful when first trying to discuss reclaiming that intimacy. Start with you. Before confronting your partner about intimacy or sexual, be sure that yourself to recognize your own feelings, desires, and needs. And I know I've said that a few times, but it truly is the most important part and the step that everyone tries to step over, because sometimes we don't want to sit with ourselves. We just want the problem to be fixed and we just want to do what it is we want to do without really realizing that if we haven't addressed the cause of these problems, it's just going to come right back. Sitting with your partner. On quiet moments, sit with your partner and test the waters of these conversations. Be gentle with your partner. Be gentle with each other. These are very personal. These are very personally intimate topics. And for some people, they're very hard to talk about. I've spent many, many years talking about these things. So it's very easy for me to have conversations about any of these types of things. But I've also sat with people who were raised, whether they're from an older generation and raised to not discuss these things openly, or they've been in a religious setting their whole lives and they've been taught that they cannot talk about these things because that puts different stresses on their situation. We really have to give each other the space and time we need without being too pushy, even in idle conversation. Make the timing right. Some people may not always be open to discussing intimacy or sexually related topics. Don't assume people are okay with having these conversations. It's always good to kind of gently ask, hey, I've got some issues with my intimacy needs. Is it okay if we talk about this now? And make sure everybody's on the same page before you just jump in with a shocking conversation. Some people have even said before, which is why this is here, schedule an intimacy chat. Actually, take an hour out of the weekend and schedule it and be like, this is the time we're going to sit down and have a discussion and kind of work things out. And that again is different for everyone. And some of these things are much easier said than done. But again, that practice. Reminisce. A gentle way to approach the topic of intimacy and sexual needs, especially if it's lacking in your relationship for a while, is to reminisce with your partner about easier early days. When your intimacy and sexual needs were flowing, when you were around your partner and the happiness brought you those butterflies and you got all excited and happy and lovey. Talk about those times, sit and remember those times and make it a point to focus on all of the good moments surrounding the type of intimacy you shared then. And if you're not in sync with your partner, meaning you're not connecting, you're not meeting up, these types of conversations and with intimacy and sexuality, they can feel really difficult, almost like some of the most difficult conversations you'll ever have. And we always say, if that's too difficult, really take a step back and approach the topic even more gently. And I know, how do you approach it more gently? It just needs to be talked about. Take away the pressure. So make sure that your partner knows, or the stressed out person knows, that actual physical sex is not being pressured in the moment. That simply having the conversation about intimacy does not mean that we are going to have to take any action or do anything within any time frame, that it is just a conversation, that it is just informational so that we can learn more about each other. Kind of like way back when you first started dating and you just spend hours sharing information, kind of take it back there. Nerves and response. These topics are hard for many to openly discuss or even admit that they are having a problem. So in a lot of situations, we hear from a couple and one partner will reach out and say, so my husband is struggling with maintaining his erections, but he will not talk to anyone about it. And so in these types of situations where one person is ready to talk about it and the other person is not at all ready to talk about it, we suggest giving lots of space and easing into it. Maybe if they have email or the internet, sharing a link to an article that kind of easily steps into the topic that they are trying to discuss, and giving them the time to read it on their own, to think things over, and sending information without making it a in-your-face conversation, so to speak. And then, of course, getting help. Counselors, therapists. If you are seeking help with intimacy or sexual function related anything, with or without grief, seeking the help of an ASECT certified counselor is best. These types of counselors and therapists have a special training and they are inclusive, to be sex positive, and have those special knowledge and special certificates that really helps them to get to the root of intimacy and sexual issues. We have lots of them partnered on our page, and that is something that we help people find counselors and therapists like that. So if that's something you need, we're more than happy to help. And then, of course, the grief and intimacy when it comes to the loss of a partner. And this quote here: the key to embracing a new partner in your life is by getting to know the changed person you have become since this loss. Give yourself the space you need to explore the new you first. And that was from Corinne Land, which is a grief specialist and author of The Art of Grieving, which is a fantastic book. If you are suffering from this type of grief, I would suggest it on the reading list. A few key points to remember, and these key points were given to us by one of our partnered licensed therapists who works with people through grief. The first is to take your time. The worst possible pain is losing your life partner, and rushing yourself through this grief can trigger even worse or long-term effects. And the long-term effects she's referencing are mental effects and even physical effects, because grief and such strong emotion can actually hurt and hinder our bodies. Sometimes it can even cause sickness. And I know there's lots of studies now where even cancer and autoimmune issues are linked to things like that. So some people find that after a certain point, they crave sexual connection with someone new, but avoid all emotional connection. For others, it's the opposite. Both are normal and allowed. There is no right or no correct amount of time to grieve, and being intimate with someone else does not negate your grieving or love for your partner in any way. That said, there is a whole new set of emotions that will come when you are finally intimate with a new person, and it will require some work on your part to get through. And so basically what that is that for some people, if the loss of their partner comes, some people take a lot of time, all the time they need to be with themselves, by themselves, and kind of avoid reaching out to anyone else intimately. And that is okay. There is no requirement that after a long-term partnership or marriage that someone goes and finds someone new and does it again. For other people, after that loss, they seek and crave intimacy, not so much an emotional connection, but more the physicality of intimacy and sexuality. And for some people, they go out and seek just that, and that's okay too. And so she really wanted to point out that regardless of how you are, if you are taking the time to mourn and grieve and remember your spouse by yourself with your family members, or you step out to find intimacy on your terms again, it's okay. Remembering them. Another quote from Corinne Lan: love lives on even in others. You may find yourself thinking extra about your lost partner while with someone new, and that is totally normal. The love and experiences you shared and all the memories over the years will always be a part of who you are as a person. Being honest with your new partner about these thoughts, and consider sharing some of those memories with your new partner when they do arise in the moment, can help ease your mental strain. It also helps to keep your partner's memory alive and keeps the connection, even in the face of you spending time with a new person. So often when we reconnect after we have lost our partner, the people that we are connecting with can be very considerate. Some have even gone through same situation or similar situation with loss, and that can make it easier to connect on that level as well. Let go of the guilt. Guilt will appear in many actions you carry out without your partner, especially those tasks, actions, and life happenings where you were connected. The changes that death, loss, and grief brings can trigger guilt to arise in the quietest places of your life. And that's something that she said that she focuses on a lot with people, is the guilt. She hears that they feel guilty for going out and talking to new people, for going out and having happiness in life, not even with a new partner, just with friends and family. And really accepting that guilt and learning all the different varieties of guilt that are coming in your life will help you to again, ease that mental strain and be able to move forward. And again, get help. Do not wait to seek out a specialist if you are facing grief, especially after the loss of your partner. Therapists and counselors can help with your mental strain, stress, and some have been specially trained to help with intimacy and sexual related issues. Keep working on grief and moving forward. Understand that grief may be a permanent part of your life, but in no way does that mean that your life is over. Allowing grief in your life as you need to while still finding all the love, passion, and future plans that you can. And I think her message with that one is that grief can ride along with us in life. We can still experience happiness. We can still make new memories. We can still experience all of the things, even if we are still feeling grief. Hearts will keep beating until they're not. And we are capable of feeling all of the emotions, while some of them are not so great. The same. All right. Any questions about the grief sections? I'm checking the chat really quickly. Okay, another website question, which again, I will post the website details and answer both of the questions about that here in just a minute. Get through this. Take a quick drink again. All right, part 3, sexual dysfunction. So this is the section where we will discuss kind of the most common types of sexual dysfunction for men and women, and then the different types of holistic devices that are out there that you can look for if you are struggling with these issues and kind of how they do, what they work. Sexual dysfunction occurs due to damaged nerves and cells during medical treatments, life stressors, body changes, loss of body parts, medications, medical treatments, of course, chemo, radiation, and lots of medications for long-term illnesses. Most all humans will experience some form of sexual dysfunction in our life, whether it be occasional, partial, permanent, just depends. Sexual dysfunction is defined as any issue or problem causing struggle to achieve sexual activity with the self or another. And the bottom line for improving intimacy is to give yourself time to heal and practice all the self-care you can by being sure to give yourself space for every level of reclaiming your life. And these 2 questions here, what sexual dysfunction side effects are the most difficult for you to live with? And are you aware that there are options for helping with sexual dysfunction issues? Self-discovery and accepting your body. Self-discovery is a form of self-care and reconnecting with your body and mind to learn and embrace the changes and intimacy needs. This includes masturbation. Masturbation, is the touching of one's genitals for pleasure in various ways. It can be done alone. It can be done with your partner. It is a perfectly healthy and encouraged way to awaken your body, to learn and adjust to the new abilities after your treatment, and discover new ways of doing all of your old routines. Masturbation is proven to release endorphins, which cause feelings of physical and mental well-being and happiness, promotes better relaxation and sleep, enhances our self-esteem and our body image, reduces stress and relieves tension. And it also helps you to get to know your body again, your pleasure zones, the things you like, the things you dislike. This becomes really important after we've had any type of surgical intervention or body change, because a lot of times those places that we had the surgeries, they don't feel the same anymore. Sometimes they hurt when they're touched. Sometimes there's no feeling left where they were touching. And so these are the moments where we kind of have to find those new pleasure zones in our body. Find the new places that we can feel things and what they feel like. And how will we ever know what they feel like if we don't try it out ourselves? So that is why this is so important. And learning those new pleasure points around our body and allowing yourself to try those new things, all that does is open more doors for you and your partner in regards to intimacy and sexuality. And then I always add the side note at the bottom. Masturbation does not cause blindness, make you dirty, have hairy palms, infertility, sexual perversion, religious deviation, or reduce sexual pleasure. Therapeutic aids or devices and holistic therapies for sexual dysfunction. So these are the 5 different therapies that we are going to talk about today. Kegel exercise therapy, dilator therapy, breast and chest massage therapy, erectile dysfunction therapy, and prostate therapy. Talk about these just one at a time, and we'll talk about the different devices that kind of go with each therapy and how they work and what they do. All of the devices that you're going to see in here are all natural, chemical free, and they're all made of medical grade silicone. One thing that I always mention, if you're out on the internet, the interwebs, if you will, looking for these devices or finding them elsewhere, you always want to make sure that they're made of quality materials. Sometimes they're not, and if they don't fall apart, the chemicals that are in some of these devices can actually be harmful to sensitive skin. So for those people who are going through chemotherapy and radiation with thinning genital skin, sometimes that can be a real hindrance and cause a lot of issues. So that's something to pay attention to. Kegel exercise therapy is the first therapy we discuss. This is a therapy that men and women can do, and it is done to help strengthen the pelvic floor. Why is the pelvic floor important? The pelvic floor is important because it sits, if my hands are hips, I suppose. So our pelvic floor muscles flow all the way through our hips, down our legs, and up our back and abdomen. It helps hold our organs inside of our abdomen. It helps us control our bladder and our bowels, and it also helps with sexual function and feeling. So what people notice the most if they are struggling with pelvic floor issues is incontinence issues. And that's like a leaky bladder or leaky bowels. And so often people say, hey, let's do those Kegel exercises. So what a Kegel exercise is the best way to describe it is when you go into the bathroom to urinate and you start the flow of urine and then you stop it and then you start it and then you stop it. Those muscles that you are using to stop and start the flow, that's your pelvic floor muscles. And so for some people with certain conditions, working those muscles extra helps to strengthen the pelvic floor, which can stop the incontinence issues and stop the other issues that are having. Now for men, they don't make specialized devices to do Kegel exercise. For males, there's lots of physical exercises that you can do to work your pelvic floor, including starting and stopping the flow of urine. For females, there's lots of different devices out there that can be used to help really focus the energy. And so you kind of know where in the pelvic floor and vagina area that you are supposed to be working those muscles. Pictured as an example of some of those Kegel exercises for women. And those are inserted into the vagina one at a time with lubrication, and they are weighted. And the point of these is once you insert it into the vagina, you use those Kegel muscles to tighten and hold it in place. And you do this therapy 3 to 5 times a week for 10 to 15 minutes at a time. And over time, that helps to strengthen the pelvic floor, just that action. And with the weighted Kegel exercisers, because they are weighted, you start with the lowest weight, and then you can work your way up through heavier weights to get to whatever point you need to get to with your pelvic floor strengthening. And that is something that a physical therapist can help you with. Some physical therapists have a specialty with the pelvic floor and pelvic floor health. And if you are struggling with that, that is what I would suggest that you look for when you're searching for the right pelvic floor therapist. We have some fantastic ones linked to our website with lots of those educational videos that I mentioned. If you are struggling with pelvic floor as a man or woman, super beneficial to watch. One thing I will say with Kegel exercise is that not everyone should be doing Kegel exercise. So many people are unaware, especially for women, that if they have a super high tone pelvic floor, which means they are having pelvic floor dysfunction, doing Kegels can actually make some of their conditions worse. So this is why we say that if you are struggling with anything related to the pelvic floor, you really should be evaluated by your doctor, your gynecologist, or a physical therapist so that they can give you some direction on the exercises that you should be doing that will benefit you the most. And then pictured here is the example of our strengthen of this exerciser set. There are tons of different exercisers out there. If you are just starting and have never done this before, you want to look for one that has, like this one on the screen has a safety cord. You can see that safety cord stays outside of the body. They also make some with finger loops and different types of cords that you can hold on to so that you can keep a hold of things. When we are in control of what is happening when we're doing these therapies, that often makes us feel more mentally stable and level and not quite as fearful of what we're doing. So just a suggestion there. So that's Kegel exercise. If you have any questions about that, you can put it in the chat. And then next is dilator therapy. And Kegel exercise and dilator therapy have been around for hundreds upon hundreds of years. Dilator therapy is used to help ease the pain and discomfort in the vagina by stretching the tissues, muscles, and vaginal walls, which increases the pliability and natural function that was lost. When we do routine dilator therapy, which again is much like Kegel's, 3 to 5 times a week, and you use the dilators for 10 to 15 minutes a time, women can find over time that they have less pain with gynecologic exams when they insert the speculum, when they are using sexual aids and products, or even for penetrative intercourse. They'll find that their vagina and vulva is much more pliable, and that doing these things regularly actually kind of awakens those cells and tissues and can also restore the lost moisture, natural moisture. Dilators can also come in a variety of types and sizes. We always suggest that people stick with medical grade silicone because this is soft skin feeling, and it's not hard plastic, it's not glass, and there's no chance that the medical grade silicone with a lubrication can catch our skin, our genital skin, and cause a tear. Because again, that's one of the biggest issues for people, these types of therapies, is having kind of side issues happen because of skin tearing or infections or things like that. And with the dilators, you start with the smallest dilator. So often we are encouraging people to start with something the size of their pinky, their own pinky, not someone else's pinky. And once you find the size that you're comfortable with to begin, you use that dilator for 2 to 4 weeks, 3 to 5 times a week, and you insert it into the vagina with lubrication. And some people leave it sit there. Other people will move it around and turn it slightly. As you can see, the dilators most often come with some kind of handle on the end, a loop, or again, some kind of cord. So they're easy to hold on to. And whether you just leave it inside or you move it around and turn it, the goal and point is that the more you do that, the more it can help the vagina go from closed to however open you need it. Because much like the Kegels, you work up from the smallest dilator and you go size by size by size until you get to where you need to be comfortable for that gynecologic exam or for that penetrative intercourse, whatever you're looking for. Some dilators have features. Some dilators have vibration, some do not. Vibration can be very helpful for those people who are new to dilator therapy and who are very hesitant to give this a try. For those people who do not have a good relationship with their vagina or their genital area, vibration can actually help relax. If we think about it when we go to the chiropractor or those big back massagers that you can get, all of them vibrate in a variety of ways, and that vibration helps to relax our muscles. So same thing, when we're putting vibration on our genital area, not only can it be pleasurable, which it most often is, most of the time, it also helps to reawaken all those nerves and helps to bring things back to life. So again, something to think about with those. But again, that suggestion with dilators is if you're out there looking for them, make sure you're getting a set that moves with your body. So the ones on screen are actually bendable. Vaginas are not a hard, hollow tube. They move with us. So when we move around, it is moving with us. So a rock hard plastic dilator that is just straight up and down might not be the best for your body. So just things to think about like that. Oh, and here's just another example of different types of Kegel exercisers. I know we showed this strengthen here with the safety cords here. Kegel balls come in a variety of shapes too. That's one thing I didn't mention. Lots of different shapes, lots of different textures. And again, that just depends on your likes and your dislikes and the goals that you have. And that's something else that your doctor or your physical therapist can help you determine the best shapes and types of Kegel exercisers and dilator sets. Another thing here kind of goes along with dilator therapy and even Kegel exercise for women is this pelvic floor therapy and internal massage. So sometimes women face issues with vaginal tightness, with pain, with insertion pain, and on top of doing dilator therapy with their physical therapist, they also have them doing gentle internal massage. And what that means is that a small thin wand is inserted into the vagina, um, all the way almost up to the cervix or where the cervix would be if that has been removed. And the gentle vibration and gentle pressure helps to break apart scar tissue, helps to loosen those tight muscles, and just generally helps to relieve the pain in that area. There are lots of different types of wands like this. Some of them are cooling wands that you can put in the freezer before you use it. So if you're having severe pain in the area, it acts kind of like an internal ice pack, which is great. They also have types that are heated. So you can have almost like an internal heating pad if you are struggling with that type of pain. And this therapy can be very beneficial, partnered with dilator therapy or Kegel exercise therapy. Breast massage therapy. This is newer. This type of therapy is about 5 to 6 years old, and the devices for it are just about as old. They look like this. There's about 5 to 10 of them on the market, all different colors. These are made for men or for women. And these are designed to be placed across the chest, whether the breasts are still there or not. And this helps to relieve pain. This helps to, the low vibrations that it delivers, helps to awaken nerves that have been damaged and helps to release the tension in muscles. And so, for people who have just had a mastectomy or chest surgery where tissues were removed, these types of things have been greatly reviewed to really help ease that pain, especially in the first few months after. The nice thing about these is their design. So this one that you're looking at here, the Whisper, is designed to cover both sides of the chest. Some are designed to just be a one-sided deal, but this one is great because it's movable. So you can use it on both sides of the chest, or you can double it for one side. This type also goes underneath the armpit up into the lymph node area. If you have pain and lymphedema and inflammation in there, it can also help with that. It can be worn in a t-shirt or even in a bra, sports bra or regular, or even a mastectomy bra. And with these, typically doctors approve use for these at about the 6 week mark after surgery. So these are out there. And so if that's something that you're experiencing pain with, it's worth a check. We have had these be partially covered before by our cancer patients' insurance companies. Of course, that depends on your personal plan and the insurance carrier and all that kind of stuff. But it is possible. So just note to self there. And then earlier we talked about self-discovery and masturbation. And there's lots of devices on the market for that too, because for some people, who have grown up not discussing masturbation or self-touch, or for the religious side of things, masturbation is a very taboo subject for people. And some people have grown up thinking that they are not allowed to touch their own bodies, that doing so is very bad. And so they see devices like these simple, small devices that can achieve the point without having them break that connection for whatever reason, that why they can't touch their own bodies. So these small devices, these are all very tiny, finger-sized different vibrators that can be used for self-pleasuring, that can be used for muscle aches and pain. They can be used by men or women, although most of these are always marketed towards women. You'll find that, which is one of those things we're also trying to work through, but that's a different story. So all of these different vibrators are just that. They have minimal vibration. Some of them do different vibration settings or have different vibration modes, but these are all very basic because really when we are trying to reconnect with ourselves, we don't always need really extravagant things to do so. And again, for other people who do not have that barrier and they are able to touch their own bodies, they might not need any devices like this because we've got hands. So you've got everything you need to get by. And then for the male side of things, for self masturbation, they have specialized devices that can help them achieve pleasure. And the best part is that for men, a penis does not have to be erect to feel pleasure. It does not have to be erect to ejaculate. They've got all the same nerves and all the same functions, whether they are flaccid or completely erect. So masturbatory devices are designed to be used by the male to find that pleasure for himself. So these devices are designed to have the penis be inserted into them. And then the Titan provides suction, much like oral sex would be. And the M2 stroker, which is pictured here on the screen, this provides a tightness along with suction. And the nice thing is that these are user controlled. So there's not batteries or extra pieces. This is just the pressure that the user puts on, gives, applies to the device when it's around their penile shaft. And the pressure and the force and suction that they choose to use with it gives them kind of a personalized experience. The Titan was actually designed for erectile dysfunction. This was designed for men to be able to use with one hand and be able to ejaculate a flaccid penis. The Titan has been around for a very long time, has very wonderful reviews, and is one of the top sellers for masturbatory devices. When you're out there on the interwebs looking at these different types of vibrators or devices, you want to make sure that you are giving yourself quality. So look for those devices that come with a warranty. I know that sounds crazy, but a lot of these devices do come with warranties. Make sure you're finding products that aren't made overseas. Try to stick with the United States. We'll have safer materials. We have better laws and regulations when it comes to the chemicals and additives in these things. And I know it seems silly to think about that, but when we've gone through cancer and radiation and all the treatment, our bodies just don't need more chemicals and more irritants that could possibly cause harm, especially in an area where our skin is so thin. So that is how masturbators kind of are designed. We like the picture here of the M2, so it lets you kind of see inside of what these things look like inside. And of course, all of these can be completely taken apart to be cleaned. Some of them are even dishwasher safe. And this is another type for men. This one kind of fits on top of the penis and the penile shaft, and this provides heat and vibration. So these are a little more involved. These are a little more specialized, and they're fantastic devices from everything that we've heard. But this specific device is designed for a realistic experience. So if you look online at this specific device, you'll see lots of reviews that discuss how it is very similar to actual penetrative intercourse for the user. But those are just 3 of the most common types of masturbators for men that are available. I'm going to pause for 1 minute to check the chat. Okay, and I'm going to answer your question too in just a minute, I promise. We're almost done going through all of these things here. Vacuum pump therapy. So this is another therapy for men, for penis owners. It's been around for hundreds upon hundreds upon hundreds of years. The first vacuum pumps were air pumps, and those were designed, I believe, in Germany. And this therapy is designed to help strengthen the muscles and ability in achieving and maintaining or keeping an erection for a man. Pump systems help to restore some or full function of males who are facing varying levels of erectile dysfunction. There are different styles of pumps now, and one or more may be suitable for your needs. And so in just a moment, we're going to discuss the 2 main types of pumps that are available out there now, so you can kind of know the differences and how they would help or hurt. But first, who should not use a vacuum pump system? Certain patients who fit into any of these categories should schedule a chat with their doctor before using the pump. This does not mean that they can't use the pump or shouldn't use the pump. This just gives an extra layer of protection to make sure that you are not doing anything or putting your body in any type of harm's way. And that's those patients on blood thinners, on blood pressure medications, those with priapism, which priapism is an uncontrolled erection that lasts for hours and hours and hours. Those with sickle cell anemia, those with a blood clotting disorder, or those with known heart disease or heart disorders. And then with vacuum pump safety, it's super important that you follow the directions of the pump that you got. So often we hear from people who years ago bought a pump because they were having these problems, but then they weren't quite ready. So it's been in the closet for a few years and they no longer have the directions. And they've just gone online and looked and found some directions for a pump somewhere and then used it. And it didn't end well. It's very important to use the directions that come with your pump because all pumps are made differently. They all do the same things, but how they do it is where the difference comes in. And the trouble that comes with pumps that men will see the most, the problem that they incur is if a pump is kind of too pressurized, it can cause what looks like hickeys on the shaft of the penis. So it's not entirely painful, other than like a hickey would be on your neck. But it can be alarming because it doesn't look like it looks on your neck. It's a much deeper, darker color on the penile shaft, and it can be very concerning for people. So we always like to warn that really the biggest issue that a pump user would have could be what looks like hickeys from the pressure on the side of their penis. But that said, again, then you'll see here in just a moment, as we talk about air pumps, that these pumps all have emergency pressure release valves too. So standardly pumps are very safe. And again, those people that I just listed before are standardly the people that react badly. And sometimes it's more of a heart issue being too excited in the moment than anything else. So getting into pumps, just the differences in them. Air pressure pumps have been around the longest. They come in from a very simple design. So if you're looking at your screen on the very right side of the screen, Optimum Series rechargeable, that is the most one of the most basic battery operated pumps. And then if you look kind of in the middle, the second in from the left, the Classic, that is the most basic hand pump. So those two are as basic as you can get with the pump. And as you can see, they don't have a lot of bells and whistles. They're just very simple. Provides the air pressure, provides the tube so that the penile shaft can grow. And that is what that does. You'll see the third from the left, the Comfort Pump. This is also considered a basic hand pump. This is basic with a pressure gauge. So this allows the user to see exactly what pressure they want to get to as they pump. And as they go, as you can see with all of the examples of the air pumps, all of the tubes are clear or see-through. This is so that the user can see exactly what is happening live. So they can watch the growth, they can see what they're looking at, and they can tell better when they want to stop pumping or they've reached their desired length or girth. Excuse me. The Leviathan on the left side then, this is considered kind of the top of the line for basic air pumps. The Leviathan is designed for one-handed easy use. Everything is removable so that it can all be cleaned. And it also comes with the base ring that would stay on the penile shaft. So how penis pumps are designed to work, just briefly. Let's look at the Classic penis pump, that one's easy to see. So the penis is inserted through the bottom black ring that you see there and into the clear shaft. The base of the tube sits on the body, so where the skin meets the tube, base of the shaft. When you use a pump, you always use lubrication, whether you use water-based or silicone, that's up to you, and we'll talk about the differences in 1 minute. And once the penis is in the tube, the user simply pumps the hand pump or turns on the battery until the desired pressure is reached. Once they have hit that point, they remove the pump. But now you'll notice that black ring along the bottom of the pumps. Those, on most of these pumps, are going to be the support ring. So once you pump up and get to where you want to be, the pump is removed, but that base stays around the shaft of the penis. That acts kind of like a support ring. Support rings are designed to help hold the blood that's drawn into the penis shaft, causing the erection, It holds it in the shaft, thusly making the erection last longer. And that's how pumps work. So pumps always require a penis support ring that goes at the bottom of the shaft against the body that then helps hold that blood in there after the pumping is complete. So those are how air pumps work. And then newer pumps to the market are water pumps. Water pumps are fantastic for people who have really fragile genital skin, those who are struggling with sensational feelings, whether that be too sensitized or desensitized. And water pumps can double also as an air pump. So you kind of get a 2-for-1 with the new water pumps. Water pumps use warm water, whether you're in the shower or you're laying in bed using it, to circulate around the penile shaft with pressure to then create an erection. The difference between air pumps and water pumps, aside from the water usage, is that water pumps require more exact measurements. So as you can see here, I put the 2 examples on. The Colossus and Commander, they are the same pump, but one is designed for smaller penises and one is designed for larger penises. And it's very important that the user, if getting a water pump, whatever brand or variety, pays attention to what size erect penis is meant for each pump. That really, really matters. And so that's something that we always try to talk about. Even with a water pump, you still want to be using lubrication when you're beginning to use it. This helps keep all the friction tears and friction pulling away from the genital area, and it just keeps you safer. So that is how water pumps work. And then prostate massage therapy. This is one of the most taboo things that we discuss at Reclaiming Intimacy, just because of the area of the body that it presents and what it does. It's been around for hundreds of years, and it is not widely recognized except with integrative doctors and some urology specialists. Prostate massage is done to clear the toxins, the built up stagnant toxins that reside in the prostate, if there is a prostate. And if there's been a prostatectomy or the prostate has been removed for any reason, prostate massage therapy can help to break up the scar tissue in the area there it was removed and helps to relieve pain in that same area. And then the taboo part of the prostate massage is that that type of massage in that area can also trigger pleasure for some people. And so for some males who have completely lost the ability to have or maintain an erection and can't find comfortable pleasure that way, they route to finding pleasure through prostate massage therapy and the devices designed for that. So the examples of the devices on the screen, while they look kind of large on screen, these are actually only finger size. So these are small, tiny probes with different shapes and features that are designed to be inserted into the anus of a male, roughly 1 to 2 inches, because that's where the prostate is. And with pressure applied, that can do the things, break up that scar tissue, help to relieve that pain, or even trigger pleasure. And much like the dilators for women, some have vibration, some do not have vibration. So on your screen, you have an example of those with no vibration on the left and one that comes with vibration on the right. And again, that is more just a personal choice, whether you like vibration or you don't. Other common erectile dysfunction aid options. So these are called wearables. You have Empower and you have Extend. On the left, the Empower is considered a jock strap, essentially, with an extra attachment that goes around the testicles to help provide an extra squeeze. Because again, as we just talked about, the penis support rings helps hold the blood in the shaft to create an erection. Putting that tightness also around the testicles has the same similar effect. These are designed to be used with lubrication and to be fit over a flaccid penis. And these devices allow for a man who cannot achieve an erection or cannot achieve a full erection, allows them to have penetrative intercourse with their partner. On the right, you have the jock strap that does not have an extra testicular circulation. This one is a wearable device that simply has a belt that goes around the waist and that the man can wear again to practice with penetrative intercourse. These are examples of the penis support rings that I was mentioning earlier when we were talking about the pumps. On the left, you will see the support rings that are designed to be used alone or with penis pumps. You'll see that the middle is where the penis and the shaft go through, and the two side rings are so it's easier to pull to get off and to put on. Thinner rings are for penis pumps. On the right side of the screen, you'll see something called enhance. Penis support rings, and these are used alone. These are thicker rings. They stretch to fit around the penis shaft, and these are designed to simply help hold the blood in the penis shaft to maintain or keep that erection or make an erection even harder. All rings, whether they're being used with a penis pump or not, should be used with lubrication. And speaking of lubrication, so water-based or silicone hybrid. Lots of different types of lubrication on the market. I like to make sure I touch on this because this is something that we find that a lot of people don't know the differences of. So first we'll discuss water-based. These are just examples of different types of water-based lubrication that are available out there. These specific types are chemical-free, they're naturally made, and that's what you want to look for again when you're looking for lubrications or moisturizers or even cleaners, is that they don't have all the extra stuff in them. When you find lubrications out there that have to say things like tingling lubrication or warming lubrication or cooling, they have so many added chemicals and things in them to make them do what they're claiming they do. And many of those things are skin irritant, and that's something that somehow gets left out of translation. So we always remind people to keep it simple with lubrication, keep it basic, avoid the chemicals, be as natural as you possibly can. Water-based lubrication is a thin friction barrier. It's going to be soaked into our skin because it is water-based and our bodies absorb water. Our genitals especially absorb things, especially vaginal tissue. So water-based lubrication will need to be applied more frequently. It will not give a great friction barrier. It will give a thin friction barrier, but one that will wear away. So it's something you'll need to pay attention to. And it is not safe to be used with water-based sexual activities. So pools, hot tubs, showers, it will just wash right away with the water. And then we'll touch on silicone and silicone hybrid options. So these types, silicone lubrications, same thing with the water-based. You want to stay away from chemicals, you want to stay away from extras and additives, and you want to stick with the most natural that you can. Most silicone lubrications are either silicone or silicone hybrid. They're all medical grade ingredients, so it's all body safe and skin safe. Silicone lubrications give a friction barrier. So this is a longer lasting lubrication. It's not going to be absorbed by your body as fast. And it can be used with water activities, shower, hot tub, pool, anything like that. Silicone lubrications are what we recommend for cancer patients as they are going through treatment and after, because the body is so dry and those friction issues are so important to be focused on and avoided. So that's what we suggest for people there. And then for vaginal atrophy, which we discussed earlier for women, that's that severe dryness of the whole area. Some type of natural daily moisturizer is what we recommend. There are lots of different prescription options that are readily given to patients who are struggling with this. And so often they do not touch on the more natural items that have been created for this, with natural ingredients using things like aloe and seaweed that are beneficial to the body and that also have vitamins that we need. Daily moisturizers are designed to be used every day, to be put on the outside of the vaginal tissues and vulva and even on the inside. They make things called lubrication shooters to where you can inject the lubrication inside the vagina so that it can really get to all the places that might be painful and dry and lots of different types of moisturizers on the market. Again, you just really need to pay attention to those ingredients to give yourself the best bet. Cleaners. If you have any type of therapeutic aid, a penis pump, a dilator, a Kegel exerciser, a vibrator, anything like that, you always want to make sure you have some type of cleaner that is designed for these types of devices. They sell them at Walmart. They sell them at Target. They sell them on Amazon, all over the place. Super important because over 80% of vaginal infections come from dirty hands, dirty parts, or dirty devices. And so that's something that we always like to make sure we touch on, is that to make sure people are taking that seriously and using the right kind of cleaners for their devices. Some people use things like dish soap or antibacterial dish soap. And while the cleansing bacterial aspect is fine with that, the makeup of the soaps will actually eat away at their devices and then kind of kill the devices. So that's why it's important to use something designed for these types of devices. And then we also have our line of breast prosthesis forms and nipples. And again, we help people with that insurance coverage if that's something they're looking for. We just have to touch on it. But those were the 5 main types of therapies and the devices that match those therapies. If you guys have any questions about those, you can add those into the chat or raise your hand here in just a moment because I'm almost done talking, I promise. One more thing, or 2 more things, I guess, and then I think we're wrapping it up. The importance of safe sex on chemotherapy or radiation. We found that this is something that was not being told to people as readily as it should have been, so something we always add in. If you are or your partner is going through chemo or radiation, or even on some medications that are similar to this, you want to be practicing safe sex. And that's not just using condoms, that counts for oral sex or any act where bodily secretions are being shared. And the risk for that is the medications and the chemo and the radiation harm our DNA and cellular composition of our cells, which could result in unplanned pregnancy with a damaged fetus. Some people and their partners are very sensitive to chemotherapy or radiation particles, and exchanging that can make that have a reaction as well. So this is why using things like condoms or dental dams, even plastic wrap, to provide a barrier in between body parts that have secretions or body fluids to avoid that sharing. And then we always ask that question: if you were made aware of the importance of safe sex as you began your cancer treatment, and if not when you began, when were you informed? And then products and L codes. And this is what I think I had a question. Let me check the chat. Here again. Yes, somebody had a question. What's covered with insurance and what is my website? I'm going to get that website in just a minute. So with insurance coverage, with these types of devices. So if you have had cancer, or your partner has had cancer, and your doctor writes a prescription for a dilator set, a penis pump, Kegel exercisers, basically anything from this realm that you might need, you can file for a reimbursement through your insurance company. Now, like I mentioned earlier, some insurance companies might not cover anything. It's just dependent on your plan, your personal plan, and what your setup is. We've had really good luck with PHP, with Aetna, even Medicare to some extent, doing partial coverage for pumps and things like that. But it really just depends. We provide the L codes or the A codes that are needed to do a reimbursement, and the receipt from purchase is what you have to fill out. And then most often, different insurance companies require you to fill out a reimbursement form. Some of them are kind of complicated. Some of them are super easy. Some can be done online. And we can help fill that form out so that you can send it in and try to get some money back from that, because cancer is expensive and gotta save a buck where you can. But yeah, so lots of the different things have L codes and A codes. Now I will say that not all sexual devices will fall under this category. So there's lots of, like I mentioned, there's lots of different types of dilators out there. There's sets that are designed for medical use, and then there's sets that are designed for fun. The fun sets are most likely not going to be covered by insurance. But if you stay with the medical side of products and the medical grade products, then you have much more chance of having coverage. And so that's something we can kind of help with too. We have people that will email us like lists of their choices for things that they found on Amazon. And we kind of go through and say, no, not this one won't work, this one is not good quality, and then, you know, give points and things so that they can kind of know what to pick for themselves. So if that helps there. And then let me scroll here. And then we have any questions that you might have. You can ask in the chat. You can ask me now because I'm about to be done talking. And I'm going to answer these questions that are already in the chat. Yeah. So I'm going to respond to everyone so you can see our website. The website is here. So www.reclaimingintimacy.org is our website. Our parent company, who houses most all of our devices. So on our website, if you were to visit there, you're going to see the devices that I showed you today that have the Reclaiming Intimacy stickers on them. Those are the ones that you've seen the medical side of use things, the insurance coverage side things. But our parent company houses basically every type of sexual device known to man. And that's kind of how we got started in all this and back in 2014. So I'm going to share that too. And there's also a code for each site should you need it. And then let's see, I missed the first 8 minutes. I just covered the insurance coverage. So if you have more questions about that, let me know. And then the website's there. And then there's another question here. The partner list of kids. To the person who asked the question, which I'm not going to say your name, I'm just going to keep it anonymous, about partner losing a kidney to cancer. They're scared of recurring UTIs or other infections that could harm or hinder the functioning of the other kidney. And they were asking if a practitioner could assure against such a disaster or if we must avoid vaginal sex forevermore. So that's kind of a multifaceted question with answer here. So there isn't a way to guarantee that a UTI, especially a bladder infection, or another infection isn't going to happen, because really that can happen even to a person that has both kidneys, you know, at any time like that. And yes, having vaginal or penetrative intercourse, actually having any type of foreplay where the vagina is, you know, in action, any type of bacteria could get in there potentially at any time. So there's not really 100% way that you can prevent that from happening. But that said, there are things that you can do to lessen that risk of that bacterial transfer or irritation so much. And that it's going to be using condoms if you're doing penetrative intercourse, or even with foreplay, if there's going to be any type of sharing of, you know, fluids or secretions. And then also making sure that you are using a lubrication that is natural, because using a lubrication prevents friction, which prevents tears, which prevents the chance of that bacteria flowing. It keeps the tissues moving as they should be as that action is occurring or that touching is occurring, which keeps the muscles and skin from tensing, which again relieves that stress so the body doesn't get stressed in that moment. And there's some other things. There's a couple of vaginal inserts, which right now the name of them is totally not even in my brain. But there's vaginal inserts that can be used after the act, that acts as kind of a cleaner, so to speak. We've had some people use before. I don't hear about those as often because they're not covered by insurance from what I remember, and a little costly, but it's kind of a natural, almost like a vaginal probiotic, I believe. So there are things that you could ask. I would consider asking your doctor, even asking the kidney doctor about, just to get their list and their take on that as well. But there are options to help lower the risk. No, unfortunately, you can't avoid that. Okay, I think I got all the questions answered that were in the chat box. If anybody has any other questions. Free to pipe in. If not, I think that that's all I've got, Miss Erin.
Thank you so much, Jen. Thank you all for everyone for staying with us. I think this was a really great presentation. This will be on our website in a few weeks. You have Jen's information. She'll also send the slides that will be distributed to you after. Thank you again, Jen. This was really great.
You're very, very welcome. I'm going to look at quick, I think. Thank you. You are very welcome.
All
If I
right,
can do
everyone have a
anything for
wonderful
any of
rest of
you,
your
have a
day.
great time.